Welcome to Nursing School Explained and this video on metabolic acidosis. If you want a little bit of a refresher on how homeostasis is regulated and how the body regulates pH balance, please go ahead and watch my other video. I'll review this concept very briefly right here also. So in general, our body produces carbonic acid, which is H2CO3, that can be broken down by either the respiratory or the renal systems. And the respiratory system breaks it down into H2O and CO2, which is carbon dioxide and water. Where over on the renal, or also called metabolic side, the kidneys break down into HCO3 minus and H plus, which is bicarbonate, and hydrogen ion. And the kidneys regulate this by excreting more or less hydrogen ion and bicarbonate, and the respiratory system regulates it by increasing and decreasing the respiratory depth and rate. Normal values for pH include 7.35 through 7.45. CO2 is 35 through 45, and bicarbonate 22 through 26. And these are just normal values that you'll have to memorize. And then this acronym, I always find it very helpful, which is respiratory opposite metabolic equal. So in metabolic acidosis now, this all refers to the pH. So in metabolic acidosis, the pH is equal or goes in the equal direction as the bicarbonate. So we know in acidosis the pH is low, so in metabolic acidosis the pH will be low, and metabolic is equal, so the bicarbonate in this case will be below 2, so it will be below 22. Just a quick little acronym on how to memorize this. And then over here, so causes for metabolic acidosis can either be too much hydrogen ion, so too much acid in the system, or a loss of bicarbonate, so too much bicarbonate. Not enough bicarbonate, which leads to acidosis. So on the hydrogen surplus side, we have significant causes, which are DKA, diabetic ketoacidosis, acute kidney injury, as well as chronic kidney disease. So think about it. If the renal metabolic system is supposed to regulate the pH balance, and then there's something going on with the kidneys, of course it can lead to this imbalance. And for acute kidney injury, we can have pre, intra, or post-renal causes, and I have separate videos on all of these disorders that you can watch a little bit more details about. Also, lactic acidosis, which is also known as sepsis, can cause metabolic acidosis. And then anaerobic metabolism, when the body is starved for oxygen and needs to switch over to anaerobic metabolism, it also produces lactate in exchange, which then will turn into acidosis. And also starvation. Think about a patient. This happens in the more Western world, when there's maybe an elderly patient who falls at home and does not get found until 2 or 3 days later. So now their body has been starved. Not only might they be injured, but they also have not consumed any fluids or food for several days. And so they might be in metabolic acidosis. If we look here on the opposite side, if we are low in bicarbonate, the causes of this can be diarrhea, because whenever we lose a lot of fluids in the stool, bicarbonate goes with it. And then any kind of malabsorption disorders where the body cannot regulate the intestinal absorption of food and also bicarbonate, then we can lose that. And signs and symptoms. So because we know that the renal and respiratory systems work together, now if we're in metabolic acidosis, so the problem is here on the renal side, the respiratory system kicks in and tries to regulate it. So when we have too much acid in the body, it tries to blow off the acid here, the CO2, by increasing the respiratory rate and trying to get rid of some of that CO2, some of that acid that's been building up. And sometimes we also refer to this as Kussmaul respirations, and that is this kind of jagged pattern of a very fast respiratory rate that the patient is attempting to get rid of some of the CO2. Along with this comes dizziness. The patient might be confused, restless, and it might lead all the way to an altered level of consciousness. They are probably going to have a low blood pressure. Think of anybody who is in any kind of acidosis, especially sepsis, most likely their blood pressure is going to be low. They might be nauseous, have vomiting and or diarrhea. That can also be a cause up here. And then dysrhythmias because of an elevated level of potassium. So let's look over here how metabolic acidosis leads to serum hyperkalemia. So in the bloodstream represented here, we have this acidotic state. So we have too much hydrogen ion or too little bicarbonate, or basically both. So the hydrogen ion is too much, there's too much of this in the bloodstream. And typically on an intracellular level, we have a lot of potassium. So what the body tries to do to get rid of some of this hydrogen ion, in addition, of course, to regulating the respiratory rate, it's trying to push some of that hydrogen ion into the cells. But when something goes into the cell, another ion has to be exchanged for it. So the hydrogen ion goes into the cell and the potassium comes out in exchange. And then in the serum, we have this accumulation of potassium. Therefore, in acidosis, any kind of acidotic state, we have serum elevated potassium levels, and we always have to be aware of the potential for dysrhythmias with potassium abnormalities. For treatment and nursing care, we need to treat the underlying cause. So if this is diabetic ketoacidosis, the patient will need lots of fluids, an insulin drip, maybe some antiemetics, those kind of things. If it's acute kidney injury, depending if it's pre, intra, or post-renal, we need to resolve the problem here. For chronic kidney disease, maybe the patient needs to go on dialysis. Lactic acidosis and sepsis, antibiotics, fluids, treatment with oxygen, any antipyretics, and those kind of things. And then for anaerobic metabolism and starvation, we just need to treat the underlying cause and see what is going on with their electrolytes, with their protein levels, all those things. For diarrhea and antidiarrheal, probably fluid because they'll be dry, and then malabsorption, treat the underlying cause to whatever is causing that. And then for nursing care, always remember your ABCs, which will also help you on exam questions in general. So for airway, we need to protect the airway. Maybe the patient needs to be intubated if they are confused and restless and not cooperative. They have a low blood pressure. Maybe they need vasopressors. B is breathing. So they'll probably need some oxygen to help them in this starvation kind of acidotic mode. And then for C, circulation, we need to make sure that we have good IV access, probably 2 good lines or even a central line, to be able to give the medications. So that would be the insulin, the antibiotics, the antipyretics, the things that we need to treat the underlying cause with. And then certainly the patient will need to be on a cardiac monitor because we have this potential here for potassium imbalances. We want to keep a close eye on their vital signs, specifically respiratory rate, blood pressure, and heart rate, on their ABGs, and check those frequently or however often they are ordered, because shifts here will happen, not super fast, but they will occur within a few hours. So we want to make sure that the treatment we're giving the patient, we're moving them into the right direction out of this acidotic state. We want to keep a close eye on their electrolytes, specifically on the potassium that we talked about, and their eyes and nose and urine output, because many times it is a renal cause, and so we know the kidneys regulate also fluids, not just electrolytes. So we need to make sure that their kidneys are still functioning, or if the function is impeded, or what their urinary output is on the hourly basis. And then also on their renal function, their BUN and creatinine, because again, the underlying cause lies within the kidneys. So thank you for watching this video on metabolic acidosis. Please also check out the videos on the other acid-base imbalances. I'll put them up here for you right here. And thanks for watching Nursing School Explained. See you soon.